Whooping cough is a highly contagious infection, and guess what? Cases are going up across the country. So we thought there was more everyone needed to know. We brought in our 9 News medical expert, Dr. Payal Kohli, to talk about it. Whooping cough, the name itself says cough. What is it?
It's a whooping cough, exactly what it sounds like. So it's caused by a bacteria called Bordetella pertussis, and it's called pertussis syndrome. Starts like a cold. So the first couple of weeks you have a runny nose, sneezing, upper respiratory tract type of symptoms, and then you start having that cough. And that cough in its severe phase can be 2 to 6 weeks. And then after that, it can actually last for months afterwards. And so even after you've resolved the acute infection, that cough can be really troublesome. And this is really a bad cough.
It's like does it sound like, it doesn't sound like that seal kind of sound?
That's more of a barking cough, but this is more of a whoop sound. So little kids, for example, the kids under the age of 1 are very susceptible to getting very sick from this because their airways are not fully developed yet. Yeah. And so if they get an infection like this afterwards, when they cough, they make kind of a whooping sound. And these coughing fits are so bad, kids can break their ribs, they can pop a lung. You're talking about vomiting, you're talking about not being able to sleep. I mean, these are severe, severe coughing fits.
I know we'll talk about hopefully prevention in a minute, but treatment, can you do anything for anybody who's got whooping cough?
So by the time you have that cough, it's kind of like the horse is out of the barn. You're already contagious and the infection has already sort of taken place. So we give antibiotics, but that's mostly to protect people around you, because when it's highly contagious and when you're coughing, you're violently aerosolizing those particles, right? You're actually mobilizing that bacteria into the air so somebody else can get it. We do try over-the-counter things as well for cough suppressants. Sometimes people will even need opioids to suppress the cough because it's really that severe.
Wow.
Yeah.
That seems like next level.
So
wow.
Like you have a baby, they're usually vaccinated within the first year or at the end of the year?
Yeah,
or when?
so it's 2, 4, 6 months, and then again kind of 3 years old, and then again right before kindergarten. And then you need boosters, because the thing about this vaccine, it's very effective, but it wanes over time. So even as adults, we need a booster every 10 years. And most of us don't stop to think about the last time we had a Tdap. So Tdap is what it's called for adults, and DTaP is what it's called for kids. But there are many people walking around who probably have waning immunity, even if they got the full vaccination schedule as kids. And because if you didn't get it as a teenager, you didn't get it as an adult, chances are you're not protected anymore, and cases are much higher than they've ever been before.
Unless you have had a baby, because I was told while I was pregnant that every pregnancy it's recommended for moms, and then adults in the household who are with the babies, parents, grandparents.
That's exactly
But
right.
in our family, I remember we had that conversation of who's had their Tdap lately. Like,
you can't come over if you haven't.
So
the grandparents did.
Yeah,
the
last trimester of the pregnancy, and the reason that you got vaccinated is so you could pass your antibodies on to the baby, because remember, we're not really vaccinating them fully until they're in kindergarten. They need 5 series to sort of get fully vaccinated. So that's to really protect the baby. But a recent report just came out that says if we continue along this trajectory, we're going to have the highest rate of infection since the vaccine came out in 1948. Because in 2024, we had 4 times as many infections as 2023. And I'm worried because I think 2 things are driving the infections. One is obviously the vaccine hesitancy. We've talked about people just not even getting the childhood vaccines, much less the boosters. But second, the organism has mutated, and the CDC has published this as well in 2019, that it's now more virulent. So we need to keep up with the new vaccines in order to stay on top of our health.
Okay, that's good advice. Thank you, Dr. Kohli. You can find more, of course, with Dr. Kohli at 9news.com/Dr. Kohli.